So today we will be demonstrating the Dermaroller technique. This is the actual device itself. It comes in a packet, okay, and we use the genuine Dermaroller.
Yeah.
It's one of the first medical microneedling devices there are. Okay. It's actually a medical device, so that's why it's sterilised.
Yeah.
Okay. That's why until I open it, it's totally sterile.
Okay.
It's actually made of stainless steel. Okay, so that's what most medical instruments are made of.
Yeah.
And then we've got this roller. Okay, and this is the magic of it all.
Yeah.
Can you see how tiny those needles are?
Yeah, they look really fine.
They are really fine. They are actually only 1.5 millimetres long, okay, and there's 192 of them, okay, in 8 rows, okay, so we've got 8 rows of it. Now, Dermaroller is just a really natural treatment actually, so you're not using any chemicals.
Yeah.
And that's really good if you've got sensitive skin, for example, and and also if you've got any sensitivity, so it's really good at not causing any problems. The nice thing about Dermaroller is it really just goes to the level of where you need it. So acne scarring, you need to get down to what we call the papillary dermis. That's about 1.3 millimetres, so we're going about 1.5. So that will really get to where we want to.
Sure.
It doesn't actually damage the epidermis, and the epidermis is the top layer of the skin. So in fact, you're not really causing any openness to the epidermis. You're just using the needle going down, keeping this quite closed.
Right.
The advantage of that is that you're not going to. There's less risk of infection.
Yeah.
Okay, so if you've got any openness of the epidermis, that can cause infection.
Okay.
But the other really important thing is that if you've got the epidermis which is closed, then any side effects to do with what we call post-inflammatory hyperpigmentation is so much more reduced. So in my feeling is that it's so much more safer to use an laser treatment for acne. So that's what we don't want. We don't want to create damage and then cause more problems on the surface. We do recommend that you use sort of ultra sun care afterwards just to protect it, but the epidermis is almost closed. The other advantage of it being closed, and another advantage to the patient, it means the downtime, the time it takes for you to get back to normal is so much more reduced as well. So, busy lives, etc. So that's a very important fact. So almost within 48 hours, you'll go back to normal.
Perfect.
If you're doing a laser treatment, that can take up to a week.
Yeah.
And most patients don't have time to do that. So what actually is it doing? So we're causing damage to the skin. What actually is it doing? It's actually causing your body to respond to some injury. We injure ourselves, the body repairs itself. So we're causing a controlled damage just underneath the skin. What happens? You've got damage. Your macrophages, which are your fighter cells, then start coming in again, and they start producing what they call fibroblasts, which are your collagen-producing cells to repair the damage. Dermaroller has been shown to increase collagen by almost 200% after 6 months. So you can get. What we've done, we've actually anaesthetised the face, so we've actually put the anaesthetic, so now the patient should not be able to feel the needling device, and that's really important. It has to be. Most patients can feel a little bit anxious about it, but with the numbing cream on, that should really dampen down any problems.
Sure.
We'll work from area to area, and the treatment should take about an hour, really. With acne scarring, obviously the indication is that we need to get right down deep where the scar is, and so we'll just work quite hard in those areas. Who can't have this? There are a few contraindications, but again, because it's very natural, most patients will be able to have it. So skin types, for example, 4 to 5 can have it because of the less risk of post-inflammatories. So for skin types 4, for example, this will be very safe. If you're breastfeeding or pregnancy, then for obvious reasons you can't have this thing. Treatment often needs repeating after about 6 weeks. And we do recommend a minimum of 3 treatments. That again will work on the basis of what we're trying to achieve with acne scarring. Slightly deeper treatment needed, and so that can often take a few more treatments after that. So we've just cleansed the face, marked it up, and started the first treatment. You can see the redness, a little bit of swelling, and also the pinpoint bleeding. And these are the exact the endpoints that we're looking for when we're doing a Dermaroller treatment. How is it feeling?
Yeah, it feels a little bit prickly.
So the patient might feel a little bit prickly, but hopefully not pain. It's not painful, is it?
No.
Work on one area and then move across the face. Looking for the erythema, a little bit of swelling, and also a little bit of pinpoint bleeding. So we've just completed the treatment and cleansed the face. And if you have a closer look at the skin, you can see it's looking a little like a red tomato. How are you feeling?
Just very hot.
So there's a lot of heat in the air because there's lots of inflammation, so that's the exact response we're looking for. Now we want to maintain the heat, so we're going to ask the patient not to put anything that's going to cool the skin down. So anything like ice, aloe vera, not to be put on. You will be provided with a soothing gel to soothe the skin without reducing the temperature, and this will come in a nice little bottle handy that you can keep in your purse as well, just so that if you're out and about. So this sort of redness will now last for about 48 hours, Within the next 2 hours you'll notice that the redness will go down by about 50%, alright? So it might feel really hot now, but the redness will go down in the next 2 hours, and certainly by 48 hours you'll feel almost back to normal. So downtime's really less. Then what you'll start experiencing is a little bit of flaking of the skin, so that's the epidermis just flaking away, By about week 1 you'll start feeling like you've got baby soft skin, so you'll start feeling really like my skin is feeling quite smooth and soft. The indications about why we use Dermaroller were the scarring. Now scarring will only be affected much later on in the process, so we're looking around 6 weeks. You start noticing the changes in the scarring. You might find them a little less faded, and also the fine lines and wrinkles and skin rejuvenation kicks in around then. We'll repeat the treatment again in 6 weeks time, and the same procedure will take place. We do ask patients to just cleanse with tepid water. Make sure your hands are clean when you clean your face. And secondly, we also advise patients to use the provided UV protection over the skin, because just to protect the skin from the sun. Any other questions that you needed answering post-care?
So just tonight I normally use the Glow Therapeutic face wash. Should I still be using that, or?
I would, you probably won't need to use very many products tonight, so just keep on putting the soothing gel cream on, If you're going to clean your face, you could just use tepid water, is advised with the treatment, but certainly once your skin feels like it's gone back to normal, and then I would then recommence your normal skincare regime. But for now, while it's a little bit red, just tepid water and the products that we provide you for post-care.
Sure.
That's great. So we've demonstrated today the Dermaroller technique for acne scarring. If you would like to know any more information about Dermaroller, please do give us a call, and thank you for watching.